It is comfy. Hello, everybody. Hopefully, we are live. I'm just checking that we're live. I'm here with Linda.
Hello, hi.
Hopefully, you can hear her. And my name's Sarah Jane. So, we're just going to be doing some laser on Linda. Oh, you are there. There, we're there. Right, let's check. There's sound. Look here.
Hello.
And there's sound. There we are. I'm just checking it because sometimes. On Linda. Oh, you are there. There, we're there. Let's check. There's sound. Look. So let me know who's there if you are there. And there's sound. There we are. I'm just checking. Right, we'll turn that off. So I'm just checking. Hello, I can see there's some people there. So we're actually on a few different places here, Linda. No pressure. Do you feel the pressure?
No, this is
I think the pressure is really all on me rather than you, but there we are. Yeah, you go for it.
Can you fix it, please?
So we'll talk a wee bit about Linda's problem first. So we're going to use today it's called the MLS Multiwave Lock System Laser, cold laser therapy. So it's a medical grade laser. Linda's got her glasses on. We're obviously all PPP'd up. We're here in TYPP Glasgow over in Kinning Park. And she's had this issue with this. It's been quite a while this has been going on, hasn't it? So why don't you tell us a wee bit? I'll pass you over the mic, actually. So you can just talk into that without breathing.
Thank you.
Deeply, please.
Just really one of these things that it comes and goes, but I like to be active on the reformer and mat Pilates, and then I like to throw about a couple of weights. And probably, as usual, it's just as well do you get carried away and you overdo it. And you don't think that you should be resting, which obviously should be doing. It's a thing that we tell clients, but it's really niggly and it's so annoying, and it just feels a bit sharp and painful when you least expect it. And I think, here we go again. And I haven't really found anything over the last few years that sorted it out. Now, I've had this laser treatment, I think it's twice now. This will be my third. And that's the first actual treatment or of any sort of treatment that I've had that I felt made a difference. And unlike anything else, it's the most relaxing treatment in the world. It's great. I'll try not to snore and fall asleep, but it's lovely. It feels good. It relaxes you. And it does have a lasting effect. So I'm thrilled to be here for my third one.
Right, thanks, Linda. So a wee bit of background from the horse's mouth there. So Linda's we've given her a diagnosis of tennis elbow. She's clearly a keen tennis player. Not, that was a bit of a joke, but you can get these injuries. Essentially, the tendons go down here. She's getting a bit of changes in the tissue. The tissue is weak. So as well as doing the laser therapy, there is rehabilitation going on, which Linda's doing that she spoke to you a wee bit about there. But what I've been aiming to do with this laser therapy, this is the third session I've done with Linda, and ideally I would do this in a weekly basis. There isn't a maximum amount of sessions that we can do if you were on a treatment protocol. It really just depends. Like, this is actually quite chronic with Linda. We had tried the shockwave therapy with you before, which can be a wee bit sore on those little tendons.
You really feel it all the way into the bone.
Yeah, wow. So the shockwave machine is over there, and really, really great for many things, primarily tendons. But Linda didn't have much success with that, so we're now moving on to laser, and we've really found this has been the big difference. So great for reducing inflammation. So we'll talk a wee bit about the kind of effects of the laser. So in terms of what's going on, you're getting that anti-inflammatory. You're also, if you've got edema, so if you had an acute injury, really, really excellent for that. So that reduction of edema. And you're also, say for example, we get a lot, I'm muscle spasms, a number of clients we get that come in, that maybe have got lower back muscle spasms, they've got into a kind of spasmic state where, something's happened, they've maybe had a problem and they've maybe slipped or fell or something, or done something with their back, and they get into that muscle spasm. So really great for those acute muscle spasms. You've also got that analgesic effect, so you're going to get that reduction in pain, and you've got that increased endorphins. So again, you'll feel a lot better. I mean, you just said that as well. You feel really great. Yeah. You're going to get a reduction in pain. But the big effect there is really that anti-inflammatory. So especially for those acute injuries, it's fantastic. So shockwave generally is a lot better for chronic injuries. But just depends, because actually it didn't really work for you. It wasn't, and this is chronic for Linda. So it really is about, that's kind of why I suppose in here we really tailor it to what you need. We have our treatment protocols, but if it's not given the result that you need, we will work with that and be like, right, let's give this a different, let's see where it goes, because sometimes it feels like it's not working.
Yeah.
But we've got to give something a bit of
See.
Exactly.
Yeah.
We've got to see. But this seems to be a kind of good kind of result for you. And you were at the gym the other day and you were saying first time, no issues.
That's right. Yeah.
So the first thing that I'm going to do is we're all PP'd up. I'm going to stick on some gloves. That's probably a good thing for me to do because I'm going to be touching you. So what we're going to do is we're going to start with the scan phase of the laser first. So in terms of that, I'm not scanning it in terms of looking through your body, but I'm scanning the tissue and essentially activating the tissue, because at that cellular level with the laser, we are activating the tissue and we're basically stimulating the production of ATP. ATP is the energy within basically your energy life force. It's what gives us all energy. So within your cells, you have ATP and we're stimulating that cell production. So I'm going to be doing this within, and it's chronic, Linda's arm. So Linda's arm's just rested here. It is primarily this area around here where she's getting the pain. So I am going to, while I scan phase, you can see that here, I'm literally just up and down now, because this scan phase here lasts about 3.5 minutes or thereabouts. And Linda, what do you feel?
Oh, I think you're just ironing out the creases. It feels lovely.
Yeah, it's nice. And it's not hot. It is a grade 4 laser.
It's not hot, it's not sore. It's just like somebody's stroking your arm. It's lovely.
And you can see how I'm just moving in quite a rhythmic way. And we've got the laser just basically going through into the tissue, just stimulating the tissue. So this, as I said, is the scan phase. And the device is just right behind me. You can probably hear it beeping away, telling us that it's doing wonders. And we're just going to take this up into the upper arm. And again, feel okay, Linda?
Yep.
She's quite happy to get this done. She's like, I was
so
like, do you want to get some laser done
so
on that arm? She's like,
yeah.
Of course I do. Side effects, what would you say, Linda? You tell me what the side effects are.
Positive. It's really quite relaxing sitting here with us. It's lovely. But the only side effect is that your arm feels better.
Yeah, exactly.
Your injuries, pain is reduced and everything subsides, and brilliant.
Yeah. There are no side effects, so apart from feeling a bit better, feeling better.
What's not to like?
How many treatments? Let's think about that. So this is Linda's, this will be her third. She's had 2. And she's already felt a difference. So just relax that arm.
So. Yeah.
And that's just after 2 sessions. Yep. Usually what we would do, if you had an injury that was, I suppose an injury that was causing you a great deal of distress, normally 6 treatments is a kind of normal. There isn't an absolute normal, but that's what, if somebody was saying to me, Sarah Jane, if I had to pin you down and you had to give me an answer, I would give you 6. But it does depend. It depends on you, your injury, and also how you... Linda's very good at her rehab. She does our training. Mm-hmm. Many of us are not. So it depends how much you comply, let's face it. Okay. You can see that infrared light. You'll be able to see that. See how it's kind of like white. But for us here, all we can see is a bit of red. But you will see there's a... If you look on the screen, Linda, see how it's like white? Okay. Hence why we've got our glasses on. Mm-hmm. So we're taking this all the way down. Well, you can get down at that wrist.
Take that off.
Yeah, take that off, Linda. It's probably pause that. Yeah, get it out the road. So as I said, roughly, I would say about 6 treatments, and 6 treatments would cost you, if we talk about that. So each treatment is £50. Any appointment primarily in here is about that. So 6 treatments, you'd be about £300. So that gives you an idea. It's not utterly ridiculous. So I think it's important to be Transparent, so you've got an idea of what cost. But if you only need 1, 2, then it would just be the cost of that appointment. Okay. But the first thing we would do is we would see you, we would give you a thorough assessment, make sure we had a correct diagnosis, and then from there get a treatment plan made up. Now, usually when I'm seeing a patient, I'm not usually just doing laser. So today, I've had in a very mixed caseload of patients. And usually when I see patients in, I might do a bit of manual therapy, so and a bit of go over the rehabilitation, and then maybe finish with laser. So you heard that beeping, that was the scan phase done. Now what we're going to do is then go on to the actual pathology phase. So if you keep your arm relaxed, and we're going to go through particular points in the arm, and particularly the pain for you, Linda, is in this area here. So we're going to start there. So if you relax that, but what I'm going to ask Linda to do is just lift your wrists up and then back down. And that's it. So she's just activating. See what I'm doing there? She's activating the tendons, the muscles, and the tendons at the end of the muscles. Good. And we're right on that pain point here, and we're going to go through, we're just kind of set, just down that kind of tendon line effectively, where the issue is. Perfect. So that's us going to move again. So if you relax that, Linda. And it's quite nice. What do you feel?
Nothing. Just nice and gentle, as I say. Who doesn't like get their arm stroked?
You know? She would come in usually when I'm saying, right, I'm going to, you'd always be like, oh God, right, okay, go do it. Whereas now it's
sleep through it, it's lovely.
It's no bother. And it's quite insidious, isn't it? In the what you feel. You don't, it's not like you're going to, some people feel immediate relief. They do. Mm-hmm. They do feel that immediate relief. But other people, so I've just moved that down. So if you move that hand again, thank you. Other people, it might take a few sessions before they really start to get the full benefits of it. Mm-hmm. But you generally do feel good after your first session. Mm-hmm. You generally do leave feeling like, oh my God, that feels actually less. Especially I find with patients that are in a spasm type state. So especially if I've got somebody that's maybe come in with a back spasm, that it can be quite powerful to get you out of that. Imagine if you went into a horrendous spasm, you're not sleeping, nothing's touching the sides. And if we can get you out of pain, happy days. Obviously, we've not fixed the problem just doing that. We've just got you to the point where you're able to move, and we're able to then deal with it and get you moving better and out of that state of absolute acute horrible pain.
Yeah, because this is just right on the point, which
exactly.
is great.
So we're really getting in here. She doesn't feel any pain. No. There's no heat off this at all. The patented technology from the manufacturers of the laser really is, world class. Actually, we should say these exact lasers are currently being used in the States. So if you move that arm again, Linda, they're currently being used in the States for treating patients in intensive care with COVID to reduce the pleural inflammation in their lungs. Okay, so they're getting 14 minutes on each lung per day for 4 days. Wow. So they're really powerful. It really doesn't feel like anything when you're there, but don't underestimate what's actually happening at that cellular level. Contraindications of this, people who couldn't use it, if you were pregnant, pretty much pregnant, nobody likes to do anything to you when you're pregnant. And if you had active cancer, because we're stimulating cell stimulation, obviously if you have cancer, we don't want to do that. We don't want to increase the growth of the cells, exactly. So those would really be the main contraindications. Other things that we can do with this, so obviously as a podiatrist as well, wound healing, and then relax that hand for me, well done. So I've been working with a few patients who we've been using this after nail surgery to see if we can get the recovery of the wound healing faster. So we'll see what the outcomes of that are. So that's we'll not mention who the patient is. We'll not give away. And we also, for ulcers, now it's not something I see a lot in here, but there's a lot of research that shows that for chronic ulcerations, especially with diabetic feet, so if you've any loved ones that are really suffering with things like that, the laser can really help with that wound healing. It just helps create that perfect environment to allow the body to do the healing that it needs to do.
So would you do that round about?
Yeah, so you wouldn't touch the wound.
No.
So right now we're touching the wound. So I mean, I've used it. I've got one patient that's got a small, it's actually a vascular ulcer on his leg, and we're treating it for that. But you just don't touch the wound. So you're literally just millimeters off it, and you actually go about 3 centimeters around the circumference of the wound. Yeah, so it's quite astounding to think the power to sitting here just like, oh yeah, this is quite nice.
Yeah.
Nothing.
May the force be with you.
Yeah, exactly. But it's quite nice.
Oh, it feels lovely.
It does, doesn't it? And I'm going all the way down here, down the arm, because remember, this is where the point of pain is. But just because that's where she's feeling the pain does not mean to say that we disregard, this line here. So we're going to go back up to this, and I'll just come up above this as well and make sure. So we've got another 2 points to do after this. So the machine pretty much counts us down. The pathology setting for this particular pathology of tennis elbow is about 6 minutes. So there's lots we can get done in that time. If you're coming in for laser therapy, you will have a rehab program that we're working with you, and there'll no doubt be some sort of manual therapy that we'll be doing with you as well as the laser. It won't just be usually you'll just come in and get the laser. It really depends on what you're getting done. Like if it's wound, for example, if I'm undressing a wound, then that's entirely different. But if it's a chronic MSK condition, there will be other aspects to your program, not just the laser, but this is maybe a part of your treatment protocol if indicated. And it's quite nice, isn't it?
Oh, it's lovely.
Yeah.
So what do you find is the most, I suppose, what causes these sort of injuries? Is there anything specific?
Usually overuse. Please don't wallop me with your arm. Age as well can play its part. Sorry, I know.
So overuse and age, right? Okay, I've got 2 strikes.
but also as women, right, our muscle, as we go through menopause, now I know you're through that, so don't wallop me. I'm heading that way. But our tissues change in our body, right, and our hormone, and all of these things have to take their toll.
So there's a lot that you as the patient or the client cannot control.
Absolutely.
But it's recognising that and getting the right help.
Absolutely. So like there's just sometimes you need to, the way that I like to think about it is it's almost like, say you've got an injury and you're on a rehab program. Think about it like being on a swing, and you're swinging on the swing, and your swing starts to slow down, and your results from your rehab start to slow down. Sometimes you just need a push, okay? And that's really where my job is just to keep you going in the right direction, keep you going, and keep that rehabilitation going. And you need a good hard shove.
Seems to be help.
That's it. Sometimes I like to give you a shove over the bars.
Shove you back.
In a nice way. So we've got, that's us. So that's that done.
Okay.
And that is as difficult as that is. There's no pain there. Linda will have no side effects of that. There's no, there's things that I could do to this, prior to this, I could be doing some soft tissue work, working that up, massaging that out, muscle energy techniques. So there's lots of things that I would possibly, not always, depends on the patient. Yeah. So there's other things. So if you're suffering with like neck pain, right, or lower back pain, or like anything chronic where you're just like, I just can't get that going. Yeah. Usually, right, Linda's asked me there, why do we this? And we alluded to, well, it's usually overuse, it's usually can be age related, but it can also be, for a lot of these things, it's posture related. It's your habits. It's how you spend your time. So as everybody sits, like you all sat up as I said that, didn't you? We can take our specs off now. We've not got the laser on. Oh, that's better. You're not green anymore. So
thank you.
As we sit and we're, if you're like suffering with lower back pain, you've got to ask yourself, well, what am I doing about that? Why do we think that, so sometimes usually people will come into me and they know that their posture needs help, but they're not quite sure of even where to start or what it actually is. So it might be that you're getting neck problems, chronic migraines, whatever it is, tingling down your arms. And you might think, is my posture related, or is it that I've got some degeneration around the neck or the discs, or all of these things need to be ruled out. So that the first thing is to why are we getting this pain in the first place, and rule out any red flags. Once that's done, and if we're left with, right, it really is lifestyle habits.
Yeah.
How you spend your time, and for the majority of us, that is the case. And we can translate that into whether it be lower back pain. I mean, goodness, the number of clients we get in here with lower back pain, really is frightening, isn't it? So if you're sitting about all day and you're not moving, as humans we're made to move. So if you're not moving, you're going to get pain. You will get pain. Where we have nice, freeing, moving joints, pain can't be. There isn't pain when you have that movement. It's when we don't move. Yeah. So when we don't. So if you want to ask any questions, please feel free. But we're going to sign out there. Hopefully you enjoyed seeing how simple that was.
Yeah, great. No pain, no nothing.
No pain. Linda didn't come in today with any pain on this, so we've done this treatment today, and actually this has been the first time that you've been to the gym and been doing all your rehab and your just normal exercises without having that discomfort in that arm. So, and it's been years. It's not. So I've done, that's the third treatment I've done on her. So really, if I had to see Linda again, I'd be discharging you. I wouldn't really need to see you again.
I mean, to notice a difference after that when it's something that's been hanging about and niggling for so long, and then I'll stop doing certain exercises or certain movements and give it a wee bit rest, it will subside. But then you're back doing all sorts of things again. Think, here we go again.
So I wouldn't need to see her again, right? But she'll continue with her rehab. And I would say, well, you know where I am. Like let's chat. But you're discharged. Yeah.
Oh, thank you.
Have a fabulous Saturday, everybody. We are away home out to the sun because we've been working all day. So we'll see you all later, and thanks for tuning in.